Hi, I am Dr. C. Suman Kumar. I am consultant pediatrician and allergist at Angora Hospital for Women and Children. The most common question which mothers ask most of the time is, till what time can they give breastfeeds exclusively, and at what time can they start solid feeds for the child? So first, for this, the most common answer is, the most correct answer would be, the breastfeed should be given exclusively. Exclusively means you are not supposed to give even water or any other feeds for at least till the baby completes 6 months of age. And once the baby completes 6 months of age, the baby enters into 7th month. Right from the first day, you can start solid feeds for the child. And preferable solid feeds to start off would be always powdered cereals and pulses, which we call it as uggu in our local language, which can be mixed as a porridge and given to the baby. And it should be soft enough. It should not be too hard and it should not be too watery. You start off with very small quantity and then build it up over a period of time. Initially you give one time and then you can make it twice a day. Then after you complete 1 week after giving these mixed cereals and pulses, and in this mixture also you can give 2 parts of cereals and 1 part of pulse. You can initially you have to make only take 1 cereal and 1 pulse, and slowly you can add pulses, the amount of pulses you mix into it. And once the baby is accepting it and tolerating it, you can build up on quantity and then on frequency. And the max you can give it is 2 times, and the max not more than 3 times in a day. And once you start giving this, it's adequate quantity, you can stop milk feed for that period when you are giving this cereals and pulses. Once the baby is used to this, the next week you can build upon fruit feeds for the child. These fruits have to be given in fresh format. It should be mashed using a mixer or a grinder, mashed properly and given it in mashed format. And there is no need to hard and fast rule to boil it, but if you feel that baby would be more comfortable boiling apples and stuff like that, you can always boil the fruit, but preferably it can be always mashed and given it in fresh format. No need to add any water or sugar or any milk in it. This is as much as the baby takes in it. So by the end of 2nd week, you should be in a position to give 2 cereals and pulses, mixed cereals and pulses feed 2 times and 2 times fruit feeds. In the 3rd week, once the baby is used to taking these 4 feeds, 3rd week you can slowly introduce vegetable feeds for the baby by boiling a carrot or a tomato, making into puree, and start giving baby in a small way. So in this way, by the end of 3rd week, the baby should be in a position to take 2 cereals and pulses feeds, 2 fruit feeds and 1 vegetable feed, which should make a balanced diet for the baby. After the end of 3rd week, once the 4th week starts, then you can start experimenting with your mixed cereals and pulses, like adding a few more pulses to it. And then the following week you can add a different fruit from what you have given earlier, and then in the following week a different vegetable from what you have given earlier. So every week you experiment with either a cereal and pulse or a fruit or a vegetable. You should take at least 1 week for 1 new item, so that you know whether the baby is liking the taste of it, adapting to it well, whether the baby can tolerate that feed or not. So in that way you can be flexible, it will be exciting, and also you know what is good for the baby and what is bad for the baby. So this is how you start your solid feeds for the baby, and slowly you can gradually build it up to cooked cereals and pulses, like cooked rice and cooked vegetables, by the end of 7th month or 8th month. That's when you introduce other solids to the baby. Why we should wait till 6 months of age as far as introduction of solid? Why not earlier? See, if it is a term baby tolerating, gaining weight well, exclusively breastfeeds, then the intestine takes its time to develop in order to digest these solid feeds. So the intestine develops its maximum when given exclusive breastfeeds for the first 6 months, and it doesn't interrupt with the immunity provided by exclusive breastfeeds to the baby. And the chances of baby having digestive problems, chance of the baby developing infections at a later on stage would be much lower if the baby is exclusively breastfed for the first 6 months compared to the babies who are fed much earlier. Thank you.